Hi, my name is Tara Torres. I'm a nutritionist here with Dr. Radha Tamarisa at Katie Integrative Gastroenterology, and today I have PA Chelsea Halbleib with me to talk about acid reflux. I'm going to go ahead and share my screen with you. Today we're going to be talking about what exactly acid reflux is, what the causes, symptoms, diagnosis, and treatment are.
All right, so acid reflux can present for a number of reasons, and patient symptoms can vary one by one. But essentially what happens is the lower esophageal sphincter, which is called the LES, lays between the esophagus and the stomach. And when that relaxes or doesn't close properly, you can actually have stomach acid that can come up into the esophagus, and that can produce the acid reflux symptoms. So this can be burning in the chest, pressure in the chest, you can have belching, burping, you can have trouble swallowing, pain with swallowing, you can feel a lump in your throat, throat clearing. Various symptoms can present, and every patient's a little bit different. So like I was talking about the different symptoms that produce, sometimes what the main cause can be is a hiatal hernia. And so while there's other factors that can produce acid reflux, a hiatal hernia is when that stomach actually moves up into the chest cavity. So essentially the diaphragm separates the chest and the abdominal cavity, and the stomach ideally sits below the diaphragm in the stomach or in the abdominal cavity. So when there is pressure, that stomach will push up, and part of that stomach will be in the chest, and the lower esophageal sphincter is not as tightly closed as it should be. So with that, you're going to have those symptoms, the burning, the heartburn. You can actually have acid come all the way up into your mouth at times. Other factors aside from the hiatal hernia can be certain foods. So acidic foods, tomato-based, chocolate, alcohol, citrus, peppermint. There's different foods that will relax that lower esophageal sphincter and contribute to the heartburn. Other things can be large meals, not waiting 2 to 3 hours before you digest your food and then lay down. Being overweight adds some pressure onto the abdomen. Snacking close to bedtime, even drinking. Some people will have, water before they go to bed, and that can also contribute to the heartburn symptoms. Smoking, if you're pregnant, that increase in pressure obviously will facilitate some of that movement upward with the acid. And then certain medications can also cause it, like aspirin, ibuprofen, blood pressure medications, and some muscle relaxers. So we've talked about this a little bit, symptoms again vary. So a lot of times people can have a bad taste in their mouth, bitter taste, they'll feel that acid. In the morning they may have some throat irritation, they clear their throat often, especially after meals, cough after meals, burning in the chest, chest pressure, chest pain, bloating, distension of the stomach, upper abdominal pain, hiccups, nausea, even weight loss. So there's various symptoms. Sometimes people even have pulmonary type symptoms like wheezing and cough, and they're not necessarily expecting the heartburn. So some of these are even termed silent reflux, where you may not even notice that you're having the typical symptoms. Of course, there's some more serious symptoms, like if you're having bloody or black stools, that may indicate that there's some type of GI irritation, whether that's an erosion or a stomach ulcer, and that's actually digesting through into the stool and turning that stool a black color. So different symptoms for various patients. It's not always obvious. Sometimes it comes from referrals from other doctors. You may see ENT, you may see pulmonology, and we all kind of work together because they can present differently. So how do we diagnose acid reflux? A lot of times, there's symptoms like I was talking about that may make us suspicious of them. And there's different types of medications that sometimes people will even talk about using and getting relief with them. But ideally, if we're trying to truly say, is this acid reflux and what is the contributing factor, is a couple different types of testing. So one's a barium swallow. This is almost like a live action x-ray in which you are swallowing barium that has a tracer in it so they can actually watch it go down. So when you're standing in front of the machine and drinking this barium, they can watch it going down the esophagus, into the stomach, and into the small bowel. So with that, they may actually capture acid coming up into the esophagus, which obviously tells us what's happening at that moment. They also can use that to see if there's any severe inflammation. A hiatal hernia can be diagnosed that way. We can also see strictures or narrowing in the esophagus. Now, sometimes those studies are totally normal in that moment, and you still may have heartburn or acid reflux. It's just that it wasn't captured during that study itself. Another test is called esophageal manometry, and that is when a catheter is kind of placed down the esophagus with different ways to check the pressure in your swallowing. And so with that, we can actually see what's happening. So sometimes, again, people talk about acid reflux symptoms, and it may not just be acid. There could be a motility component to the symptoms. There's different conditions, and that's where that testing helps us actually look at the pressures of the esophagus and the lower esophageal sphincter to really tell, is it closing normally, is it too tight, or is it actually pretty weak? pH monitoring, there's a couple different ways we can test this. One's called a Bravo test, where there's a pH probe that's placed during an upper endoscopy, an EGD, which I'll talk about in a second. And also during the esophageal manometry, sometimes a catheter, again, can be placed down the esophagus and measure the pHs over a 24 to 48 hour time period. So during those episodes, you can see what the pH level is. Obviously, a little bit more invasive testing. There's the endoscopy as well, which is also called an EGD, and this is done under anesthesia. It takes about 15 to 20 minutes to do. So while you're asleep, a scope is gone down through the, in the mouth, through the esophagus and into the small bowel, or into the stomach, and look at the first section of the small bowel, the duodenum. So the benefit of the endoscopy is, one, we can see surface level, is there inflammation? Are there erosions? Are there ulcers? Is there a hiatal hernia? We can measure the size of it. If there is any inflammation anywhere in the esophagus, the stomach, or the first section of the small bowel, the duodenum, we can take biopsies. And with that, we can tell exactly what's contributing. So whether this is bacteria, yeast, dietary influence, medication, celiac disease. There's various things that we can see during the endoscopy, but that's an easy way to look and really truly confirm that you have acid reflux or heartburn symptoms.
Okay, so there are a few things that you can do as far as your diet and lifestyle. Again, addressing some of the food that she had mentioned earlier in the slides. You want to avoid any caffeine, citrus foods, or anything that falls outside of those foods that is triggering your reflux. Eating smaller, more frequent meals throughout the day, quitting smoking, putting blocks under the head of your bed and raising it a couple of inches, eating at least 2 to 3 hours before you lie down and allowing that food to actually digest and move. Try sleeping in a chair for daytime naps, not wearing tight clothes, losing weight, and then, of course, medications, which I'll let Chelsea talk about.
So for medications, some of these you can get over the counter, some are prescriptions, and looking at them, there's some that produce immediate relief and some that actually take some time to really build up in your body and provide that relief after several weeks. Now, ideally, you can take these and you should be able to get relief with your symptoms, but if you're having to rely on this quite frequently, even more than 2 times a week, we're really wanting to understand, why are you having these symptoms? What can we do to help alleviate the symptoms and really understand why you're having heartburn? So there's kind of basic medications over the counter. There's antacids, and these are going to work really quickly. You can take them several times a day to relieve the symptoms. Examples of that are Alka-Seltzer, Maalox, Mylanta, Tums, Rolaids. So these just really kind of neutralize the stomach acid when you're having the heartburn. But there are some side effects sometimes. They can be constipating if you overuse them. Some people can even have diarrhea. So again, we want to be cautious if you're having to use these a lot of times. The magnesium that's in them, and sometimes there's other products that can create side effects. They can raise different levels in the blood if they're used for a long time. So these are things that we still want to be cautious on, even though they're pretty benign to use. Ideally, again, we don't want to use them for extended periods of times without understanding why you're having the symptoms. Up from this, there's other types of medications. There's H2 blockers, which is like Pepcid or famotidine, Tagamet, Cimetidine. We used to have Zantac on the market. So these work within about 30 to 60 minutes and produce symptoms, produce relief for your symptoms for usually an extended period of time, like 6 hours, 12 hours. Again, they're decreasing some of that acid production. They have an antihistamine component, so when people have a lot of postnasal drip or throat clearing, it can help with some of those symptoms because of the histamine approach. There's other products like Gaviscon that really coats the stomach. There's some other components. There's a UK version that we recommend often, Gaviscon Advanced, and it produces a biofilm in the stomach to prevent some of that acid from actually coming up into the esophagus. Proton pump inhibitors, this is Nexium, Prilosec, Prevacid, Protonix, and Meprazole, there's various names. Comes over the counter and as a prescriptive dose. This actually takes about 2 to 3 weeks to build up in your body. So there's some people that take this as needed. Again, you're not necessarily getting the most benefit out of it. But this is used a lot of times for its anti-inflammatory approaches. But long term, there's definitely been some studies that have shown some negative connotations with this medications. So we're trying not to use this for a prolonged period of time. Ideally, over the counter, you'll see the recommendation for about 14 days. Really, within about 3 to 4 weeks, you should notice improvement. And if that's not working, we really need to look outside the box for why you're having these symptoms. Other medications, again, kind of cautious when we use these are prokinetics like Reglan, but they can help strengthen the lower esophageal sphincter. They can help with digestion. So if your food is not digesting and sitting in the stomach longer, of course, you're going to have some heartburn symptoms with that. But some of these, there's various medications that can provide relief. Some work better than others, but again, we really want to ultimately understand why are you having the symptoms and how can we fix this so you're not having to rely on these medications for a prolonged period of time. And then, again, we focus on diet and lifestyle changes as much as we can. There are other factors that, of course, play a role in why people have heartburn, like the hiatal hernia. Sometimes this can be managed by watching the portion size and the timing of meals and weight loss. And other times it may be larger. There may be factors outside of our control, and we're not having success to really control these symptoms, whether that be with medications or if we have to rely on the medications for a prolonged period of time. We may then talk about surgery, because ultimately, if we can reduce some of these medications, especially some of the proton pump inhibitors, that would be ideal. So there's different methods of how we can do surgery. There's one procedure called a LINX that is a little bit less invasive than it has been in the past. And this is when there's essentially a ring that's put around the lower esophageal sphincter. And that tightens up that muscle there that we've talked about so that you're not having as much acid reflux. The one positive thing is technically it can be reversible because there's not really much modification done there with the GI tract. So if ever in the future that needs to be removed, it can be. Another procedure is called the fundoplication. And again, this is a lot of times what's necessary, especially if there's a hiatal hernia involved, that has to be fixed. But something is wrapped around the LES to, again, kind of strengthen that. So similar method, we're a lot of times strengthening that lower esophageal sphincter to prevent some of that acid coming up into the esophagus. But again, there's other methods. If you have a hiatal hernia, that changes things. There's different forms of hiatal hernias and different sizes. So that can definitely be a factor when we're trying to decide surgery.
So we've covered a wide range of topics today regarding acid reflux, and I think the big key here is to understand that there are a lot of things that you can do on your own as far as diet and over-the-counter medications. But if you've been doing these methods and making these changes, or you've been using over-the-counter medications for a while, you probably want to touch base with your gastroenterologist to see what other options there are for you as far as treatment, and also make sure that you're addressing the underlying root cause of what is causing your acid reflux. And I think that's something that we do really well here at Katie Integrative Gastroenterology. We mix the best of both worlds, traditional medicine and nutrition and functional medicine. So we really work on focusing on empowering the patient to be able to do the things that they need to do as far as diet and lifestyle, but we're also here to support you with the different medications and tips and tricks that we work so well with our patients. So if you have any questions, you can always reach out to us. Our phone number is 281-869-3009. We do have a website. We're on Facebook, social media. So please feel free to reach out.
All right. Thank you. Thank you, Tara, for organizing this.